Hello, and welcome to episode number 4 of Sports Therapy Association Extra, our new podcast where we create some content by members for members. Today we have with us fellow regional rep, Dan Ba Thein, who is a soft tissue therapist and also regional rep for South Wales. Welcome. Thank you for joining me. How are you?
Very well, thanks. Thanks for having me.
Good. Yeah, no. So today, Dan has said we're going to have a discussion about muscle energy techniques. So, Dan, do you want to tell us a little bit about you?
Yeah. I'm sports. I'm a soft tissue therapist, and I've been practicing since about 2008, where I started as a remedial massage therapist. Since then, I've taken on further training.
Yep.
Including the ISRM level 5, the John Gibbons certificate. So I've kind of stepped it up a little bit as I've come along. So the work that I do is in three parts, where I've got some elite sport work that I do, where I provide soft tissue sessions for Commonwealth medal winning kind of level athletes, and then
so that's pretty high level then.
Yeah, and there's been a couple sort of hoping to get to the Olympics. Now I haven't really been because of the pandemic. I haven't really managed to sort of catch up exactly what's going on there now, but so that's the sport work. And then in my clinical work, I do mainly I'm dealing with maybe middle-aged to elderly people who just want to get through the week without really having to be in so much pain. So that's mostly what I do in my clinic. And then I've got the CPD stuff. So I teach some CPD workshops.
Okay.
And muscle energy techniques is one of them.
So where do you run the CPD courses from?
Well, I just really I might hire a hall in the town where I'm living, or I'll hire somewhere. I was last year. I started to get it kind of fairly nailed down. There was a training school about 20 miles away, so I was going to start working from there. I taught a couple there. The last one that I did was just a week before lockdown, and so just sort of near Swansea is where I'm based. And I'm hoping to sort of move more sort of Cardiff, maybe Newport area at some point as well.
Kind of move around a little bit. So how did you fall into that, out of interest?
Into the CPD?
Yeah. How did you make the transition from kind of clinic to educator?
Well, I think because I've got four diplomas in like remedial massage, sports massage, and then I did the one with the ISRM. I've done all the John Gibbons workshops, and so I've had quite a bit of input from some decent trainers. I was mentored when I came out of college. I was mentored by a sport therapist, and so I feel like I've spoken to people coming out of college, and a lot of people who have done college courses were taught in a different way. The guy that taught me in the level 3 and 4, he used to teach from El Cash. So a lot of what I've had has come from the same sort of direction. And I think the focus is maybe slightly different in some of the training. And so I feel like, and because, I've got, over 10 years experience under my belt, and I've worked in sport at kind of most levels, and then quite a wide degree of experience in what I've treated, I feel like I've got a reasonable amount to offer, either newer therapists coming out of college, or maybe people who've been perhaps doing doing like sports massage or whatever for the last 10 years, and maybe some of them have progressed quite well, and some of them have just stayed doing the same thing. So I kind of feel like I've got a reasonable amount to offer, I suppose.
I think that's the key, isn't it? It's kind of, I think one of the best things to learn is from other therapists. I remember when I went back to university, and I picked things up from, like, I went back to do a master's after doing my degree years ago, and I picked stuff up from like people who were just learning now. And I think you need to kind of be humble about it and always be continuing to learn. And I think what you said there as well about people not continue, they've been doing the same thing for years. I think CPD is a huge aspect of our profession. And with it being unregulated, I think at times it becomes a little bit neglected in some quarters. So no, I think it's interesting. So today we're going to be talking about muscle energy techniques. So kind of explain to me kind of your idea behind muscle energy techniques, kind of the theory behind it, really.
Well, in my understanding is that there's that it works by a kind of like feedback through the nervous system. I can't claim to go into any infinite depth about it, but in practice, it kind of the muscle energy aspect of the name is that you're using really muscle contraction to find a new range of motion, assuming that it's muscular, that any limitation in range of motion is muscular. And so, yeah, really, you're talking about in its sort of most basic form, using an isometric contraction to then facilitate an extra gain in range of motion. But of course, there are different methods of applying different techniques, and even the that particular post-isometric relaxation method. There are various ways of applying it as well. So it's quite a broad topic.
Yeah, I mean, I personally use it. I do use it because I quite like having that contraction element rather than just static stretching. Do you use static stretching very much out of interest?
No, sometimes I will suggest it to a client. I know it's fallen from grace, but sometimes I will suggest it to a client if I think they're going to do it, and if I think they need some range. But if I can, I'd rather they do an MET or something else. So I don't use an awful lot of static stretching, really.
No, I've kind of fallen by the wayside with that one a little bit. If it's somebody who's a little bit painful, I might get them to use it, just like you said, just to get that little bit of extra range. So one thing you kind of mentioned there is about if it is muscular and it's not something else. So establishing the barriers was the next bit. So obviously kind of different tissues, is it a muscular problem or is it a joint problem? So I think that's quite an important thing to actually know, isn't it? And obviously, how do you find the barrier within the tissues, and is it a barrier that you are looking for, really?
Yeah, I mean, generally, if you've got a fairly hard end feel to the barrier that you come across, then particularly if there's a lot of pain there, then you're fairly certain that it's going to be something pathological and needs investigation, along those lines. So using something like an MET would be at best pointless, not worse. You'd be irritating something that doesn't really want to be aggravated. Or it could be capsular, more of a kind of springy kind of feel. But yeah, I mean, really, if you've got a nice kind of feeling of a kind of reluctant stop almost, to find your, we all know how to find like end range of motion when it's muscular. But it's the one that I quite like is what was described to me as a feather barrier when I learned it.
Okay.
Which is less kind of you're not finding an end range. You're not working with an end range, but you're working more. So say like if you are like, say with rotator cuff, if you're say it's your internal rotating, and you might get to a point where this shoulder girdle starts to want to get involved. You might still get a reasonable amount of range after that started to happen, but once you start to see other structures move, and you can do it, you can palpate the idea. I know you can only really palpate what you can palpate under your fingertips, kind of on the surface, but you can feel a sort of tautness to the muscle, seemingly to the muscle.
So you're not just using the stretching and kind of the passive motion of the stretching, you're using your fingers and a palpatory technique. I suppose, I suppose things like hamstrings are quite a good one for that, because hamstrings, most people want a little bit of extra range within hamstrings for one reason or another. I suppose you can kind of use that and feel kind of like muscle tone, and kind of muscle firing. I suppose you can feel like different restrictions throughout the muscle belly, whether it's kind of a little bit more proximal, distal, which semimembranosus, semitendinosus, bicep femoris kind of thing. So you can kind of pinpoint it from that, I suppose, and kind of bias your stretch towards that.
Absolutely, yeah.
Yeah. So I think what you said there about capsular, I think that's quite an important point. Knowing what a joint feels like. In more often than not, people are coming to us with an issue. So is there going to be swelling involved? Are you going to get a different end feel? Are you going to get a bit more of a, if it's a kind of extension, kind of knee extension kind of movement, you're going to have a different end feel. So it's just practicing those, I suppose, isn't it?
Yeah, definitely. It really comes in handy, sort of getting familiar with with that exact type of thing, because sometimes you can almost do it like by almost by sort of like feel, and just like rather than sometimes not being analytical about it, but just like, no, I think I'm going to change what I'm doing to this, because it's not always, for me, it's not always that analytical. I don't want to use the word intuitive because it's kind of connotations. But actually, no, I will use it. I remember I was on a course with Leon Chato, and somebody asked him about working intuitively. I think they meant intuitively in the kind of alternative sense, but he answered it by saying he's got no problem with the idea of people working intuitively as long as they've got a solid understanding of what they're doing. So like, rather than thinking analytically the whole time, just kind of like getting a feel for what you're doing.
Yeah, I suppose you've got to trust your gut instinct sometimes as well, because
like experience,
Yeah, I mean, one bit of advice I've always given to people who are learning: just get your hands on as many people as you can. Get out there, because no matter what you learn in the classroom, it doesn't. You can feel healthy joints, you can feel healthy muscles, you can massage healthy joints and muscles, but it's different. Patients react differently when you go over sore spots. Tissues react differently. So it's getting your hand on as many different bodies and different injuries as you can, so you get to know what's what. So then, I know, I think intuitives, some people might argue against it. I don't think it's a dirty word. I think it's I think some of what we do is intuitive. You have to kind of trust your instincts, and
I think so. I think the way I see it is that if you've been doing something for a while, and if it gets into your subconscious, your subconscious will generally pick things up way before your conscious mind, is my understanding. And so, and that's part of the skill, I think, of a therapist, is having had experience. And so, yeah, you might have to bang into the wall 3, 10, 50 times, but once you've done that, then you've got that experience that you can draw upon. And I think it's part of it as well. Obviously, you've got to be analytical as well, because you've got to have some sort of rationale for what you're doing. But obviously, I think you can use experience to help guide you there to a degree. If that's all you use, then I don't know. But if you use,
I think one of the major points that we need to use is just the patient or the client in front of us. You know, they're going to tell us if we're using METs. They're going to tell us where to stop. They're going to guide us, I suppose, with our techniques with regards to how far we stretch, which direction we stretch, how much we contract, direction of contraction, that kind of stuff.
Yeah, definitely.
So, as you mentioned before, there's different types of muscle energy technique.
Yeah.
So I'll put a little thing on the screen there. So PIR, RI, and isolytic. So PIR, what's that stand for? And tell me a little bit about PIR.
So post-isometric relaxation. So okay. The idea being there that you would establish point of bind, so your range of motion, and then you would induce an isometric muscle contraction in the muscle or group of muscles that you're kind of wanting to increase the range of, and then you'd move to the new range, which is available in most people once you've done the technique, and you repeat that several times. Now, there's various ways of doing it. So you can do it where you're always in this end range. So you take the limb or whatever to its end range, contract for however long, which we can talk about, and then when you relax, take it to the new end range, and generally you'd hold a stretch. Sometimes you'd do that technique a few times and hold a stretch at the end, or sometimes you'd hold a stretch each time you do it, or both. Doesn't, various reasons why you might do one or the other. You can also do it by establishing this range, coming into the mid-range, and then to do the contraction, and then back out again. Which I find works better with things like something that's going to be reactive, like maybe a shoulder or something. If you're always in that end range, and it's often around the end range that the problems seem to start. So
So I suppose if somebody has got a painful shoulder, moving them into this range, getting them to work at that range, they might not have the capacity, or it might be too painful. So are you saying you kind of move back into a mid-range from the stretch point to get them to work, so to push against? Right.
Yeah, and that's where this feather barrier idea comes in pretty nicely as well, because you don't have to be messing around with getting to the end all the time. You can stop the technique short of where it's going to cause pain. You can do that a few times, see if that helps. Might not, but you don't know till you find out, kind of thing. But then if you're using this feather barrier as a guide, then you might not have to go through that range too much until maybe muscles release a little bit. Maybe you might just find, that is a little bit easier going through that range now. It doesn't work for every single situation, but it can seemingly have pretty good effects. So
I'm guessing it's something you use quite frequently in clinic.
Yeah, a little bit less now than I did. But yeah, I use it quite a lot. One other point here is that a lot. I think every course I've been on with MET, they suggested using a breath. So like after the client's contracted, then there's some kind of breath, either like breathe out and relax as the stretch is going on, or just take a breath and then out and then increase the range. But that's quite often used. If I let anything slip, it's that. But I think it's a nice one to help fine tune. I think another way that I've seen suggested that I quite like actually is, and it takes it away from being too kind of precise, which there's nothing wrong with, but it doesn't always work for everybody, I don't think, is do it for, hold a contraction for a certain amount of breaths. And then the person, the client is thinking about breathing, and you're thinking about maybe them breathing about whatever, but it's not this kind of like, okay, right, now start, okay, now stop, no, do it like this, do it like that. It's a bit more, it's more kind of relaxing and working with that kind of the person rather than the technique, if that makes sense.
Yeah, I've never actually used that one, but that's actually, kind of, it goes hand in hand with something else I've kind of used. I've used metronomes before.
All right.
So people concentrate on a metronome. It's more for kind of exercise based stuff. So they concentrate on a metronome.
Mm-hmm.
So they concentrating on the clicking. And it just helps them kind of subconsciously concentrate on something different than what's actually happening.
Yes.
In front. So the movement or the exercise we're doing becomes a little bit second nature. So I quite like that. I do like that idea.
I think the one thing with that is that 3 or 4 breaths to me or you or somebody else can be completely different. And sometimes you might say, okay, do it for 4 breaths. And if it's particularly people who do yoga, it seems, tell them to take 4 breaths and it will take them half an hour.
Yeah.
Nothing wrong with it. But
Yeah. I suppose you've just kind of got it. But I suppose it individualizes it a little bit more, then puts them a little bit more in control. So
yeah, absolutely, yeah.
I might actually use that one myself.
It's worth a tinker with, to be honest. And I think the other thing, along similar lines to what I was just saying, is the amount of time that you would hold the contraction and the stretch for. When I teach, I suggest people hold the contraction and the therapist will hold the stretch for 10 seconds each. It's not because it's clinically the best way to do it. It's because, in my mind, it's the easiest one to remember. And then I think once you've got it, then you can modify it. So in different training that I've had and in different stuff that I've read, you'll get one person saying, look, you can do like a 1-2 second contraction. That's enough. And then what else have I heard? 3, 7, 17. There's another one I've forgotten, 23. So to me, it's about making it fit.
Okay.
So rather than, not that I've got anything against it, but rather than this is the best way to do it, we do it like this, well, we do it like that. Learn the technique and then fit it. That, if you want to go into it and learn loads about it, which nobody has to, but not necessarily loads, but learn more about it, you don't have to stick to one way of doing one technique. You can fit it to, so like if you've got someone about to go on a sports pitch and they need a bit of return to their usual muscle length, then you can use maybe that 1 or 2 second technique, and it will. You can't. I've made quite good gains using that technique. I don't use it a lot, but I've made quite good gains with it. And you could then just hold a stretch after that to let it sort of bed in a little bit. But if you've got an 87-year-old person with a really reactive shoulder impingement or something, then maybe you would want to be more gentle and come to the mid-range for the contraction. Just approach the area where it's been causing pain, and maybe hold that contraction for less time, for more time, but less of a muscle contraction even.
So less intensive.
Yeah, so I mean the amount of contractions that I don't mention, which is normally from my training, it's like no more than 20% strength, because you're trying to return tissues to normal length rather than increase them from normal to further. So yeah, so it's quite lightly done, but you can still do it lighter and still get fairly good benefits. But I find that I think it's better to then increase the amount of, if you can, the amount of time that the contraction's on for, but just reduce the intensity, and then increase the amount of time that they're in that kind of stretch state. So, and then, you know, somebody else, you might deal with it differently, or, you know, you might, oh, we've got 5 minutes left and they got to get their
Yeah.
shoot on. So let's do it quite quickly, or whatever, you know, but make it fit to what you're doing with your client, with their needs, their expectations, what you think they need to get out of it, all that stuff. And you can end up sort of kind of tailoring it. But at the same time, I know people who were taught it on the hamstrings, and so they use it on the hamstrings, and that's kind of all they do. And I've got no problem with that either, because not everyone has to be a carbon copy of everybody else. And
No.
you know, do what works. You know, make it as simple or as complicated as you want. And I think that's one thing that I like about it. I suppose you can do all of that. You know.
So getting on to like the power bit there, because I remember when I was training, it was always like 10 to 20% power. What is how do you judge 10 to 20% power? Was always in my head. I was like, how? If I tell somebody, especially in sporting settings, you tell somebody 20%, they want to act big and macho. You know, they're just going to push into you.
I've done it myself. Yeah.
Yeah, you know, it's so it's how do you judge what 20% power is?
I've got a really good way if you want to hear it.
Go on then.
You work out what a quarter is and go a bit less than that.
Oh, fair enough. Very clever.
Yeah.
So, and it's the sense that, you know, I was always taught 10-second contraction. Some people don't have capacity. You know, some people, it's too painful for people. Some people don't have the strength to hold a contraction.
Yeah.
Even at 20%, whatever 20% is, for 10 seconds. Some people will be juddering by that point. Therefore, we're going to get fatigue of the muscle. Is that the aim of it? Probably not in a lot of cases. You know, we don't want a lot of fatigue. It's about getting more range out of it, not actually making them more tired. So I think it's just adapting, like you said, adapt to every client. I like to use the word lightly push into me or match me, and I'll guide them. If I think they're pushing too hard, I'll tell them to stop. If I think they need to push harder, tell them to push a bit harder.
I think match me is a good one. You know, match my pressure or whatever. Just I think that's quite good. And like you say, I think that's quite common, that you get a really, you know, I've worked a reasonable amount. Like the first 5 years I was working was, I did a lot with rugby clubs, and you know, you end up in this kind of battle of strength, or battle of their strength versus your structure. Can I hold this up for much longer? And thinking, what's going on? I said like no more than 20%, and he's trying to put me through the floor. But that's
yeah. I mean, I've tripped rugby players whose legs are bigger than me, so yeah, it's always a battle.
Yeah.
So moving on to the next one, reciprocal inhibition. So RI. So how does that differ from? Well,
I know that the sort of the idea of reciprocal inhibition as a kind of particularly in kind of like sort of structural look at therapy is taking a bit of a battering. So, but I think it's a term, isn't it? For this, it's a term. So rather than, if we're talking about, say, trying to increase abduction, instead of contracting the adductors, you'd be contracting the abductors. So the idea there was you know, reciprocal inhibition that was kind of causing the effect you'd be getting. It doesn't seem to be quite as effective as the PIR method, and whether or not that's exactly what's happening. In fact, I'm pretty sure it's not. That's not what's happening. I'm pretty sure it's not reciprocal inhibition that's causing it. Now I'm hoping I'm going to get this right, because I'm going to quote where I got it from, not exactly what they said, but in the Massage Collective podcast on MET, I'm pretty sure they mentioned that you don't have to contract any muscle that's got anything to do with the area. So you could be contracting a completely different muscle to get the same effect with the RI method. So if I'm wrong on that, then I hope somebody pulls me up, or you can edit it out. And when I heard that, it was quite interesting, because like I did my first thing of, oh no, surely it can't be. Hang on, that devalues that devalues, but that sort of like negates a technique. And then hang on, no, it doesn't. And then ended up thinking, well, that is really great. That's really cool, because now you've got an even more indirect way of doing the same kind of thing. There may be a situation, I've not had a chance to play around with it, but there may be a situation come up where you don't want to contract the agonist or the antagonist, and so you can contract a different muscle completely, and you know, maybe it might help, I don't know, thinking off the top of my head, maybe it might help your client sort of focus elsewhere from their sore spot or something, I don't know.
I suppose it's about affecting the nervous system. I mean, most of what we do is affecting nerve tissue. So, yeah. I mean, do you use reciprocal inhibition very much?
No.
And is there anywhere that you'd prefer that over the other techniques?
Nope. I don't use it that much. I think if somebody is, for some reason, you know, if they've had an injury in the muscle that you want to get the length out of, and it's still quite sort of it still wants to kind of flare up, then I might use it then, and again just use it really lightly. You know, you're not trying to, you might just be trying to help desensitize a little bit.
Yeah.
I wouldn't use it any one place particularly any more than any other, I don't think. But I don't tend to use it that much.
No.
But what I'd like about having different techniques, and again, like I say, you know, you don't have to have hundreds of techniques to do the same thing. But if you haven't, you may as well. And one thing I like about having different techniques is it just gives you maybe another way of treating the same thing, so which might just be useful in a different situation, you know, in different situations. So always trying to sort of chip away at, you know, somebody, you know, like any kind of like issues that, yeah, you sort of just, you've always got a certain percentage of people that you might struggle with, and if you just chip away at that percentage a little bit, just by having a different way of approaching the same thing, I think that kind of helps. And I think this is what's good with this RI method, is like, well, if for some reason the PIR method ain't going to work, then change technique. It may be you need to change to something completely different, but it's another good one to throw at it if for some reason you can't use like your main go-to technique, I find.
While you've just been talking there, I've been trying to think if I use it, and I think the only time I ever use it is use it occasionally on neck injuries. So if somebody's got a little bit of a sore neck, you know, if they're lacking a little bit of lateral flexion, and I'm stretching this side, if that's sore, sometimes I don't want them to push that, so I'll get them to push against me this side, you know, just to get the neck and the muscles, because if you contract that side's still going to work as a stabilizer. So I think that's, you know, but it also gets a little bit of strength into it from the isometric contraction. So I'll kind of work through ranges that way, and I think that's the only time I ever really use
yeah, I mean
kind of technique, to be honest.
I don't think I've done it recently, but I certainly have used it for exactly that. I think another one that I would use it for is you can use the two together, the PIR and the RI method. You can use them, you know, what the PIR going into the RI, so you can contract, you know, you contract your adductors, and then when you get a bit of range, contract the abductors, get a little bit more range, and then hold as a stretch. And you can do that a few times. So that's that's another way of just getting a little bit more out of it. If you want to, if you're struggling to get some more range, or if you particularly want to get bigger gains in range that quickly, which obviously you don't always, sometimes it's better done slowly, but it's just something else that you've got in your armory if you kind of feel that you need to, I suppose.
Good. So last on our little list on screen, isolytic. So
yeah, so this is one. Now, when I learnt it, it was all about breaking adhesions, which now it'll be to do with the nervous system and not adhesions.
I'm going to say, be careful, you'll have the people pitchforks out as now.
I know. I've got half of mine just to sort of plow on and pretend that's what I. But no, it's. I mean, it makes sense to me that it's all like nervous system, all to do with the nervous system. It's. I'm not going to pretend that I completely understand exactly how it would all work on a sort of neurological level, but I also think you don't need to know that to be able to make these things work. It's handy. It's pretty useful to know exactly, but I think that's another good thing that it's a skill as much as knowledge, really. But I think it's the closest I can think is it's like the eccentric contractions to gain muscle length without compromising any sort of strength or whatever, whilst kind of trying to gain strength. So using strength to a degree to actually use the technique. So what you would be doing is, say, if you're doing it for the hamstrings, you'd have them, say, hip flex to about 90, knee flex to about 90, so the lower leg is sticking up, knee bent, and you'd be working through their sort of mid-range of their muscle range. And as they're pushing down against you, you're pushing up against them. So you're not fighting each other, but they're providing resistance for you, and you're overcoming it. You're overcoming the resistance. And so sometimes I've seen it have better results than the other methods, and sometimes it in honesty doesn't really do anything. But not everything does everything. Not everything does what it does every single time. And again, it's one that I have used in conjunction with the other two to gain rapid range. So I'll maybe do the isolytic, then the PIR into the RI method. And then, so, you can go from maybe 45 degrees in the hamstrings to 90 in some people. But just on its own, I think it can be quite useful, but you wouldn't use it on somebody who was, infirm in any way. You'd want to screen to make sure that they were fairly they were robust enough that they're not going to do any sort of harm. But I imagine you could probably use some sort of modified version with most people, but I would just stay slightly shy of being too brave with it, just in case.
I think it goes back to what we were discussing earlier, wasn't it, about tissue capacity and whether they've got the actual resilience and the capacity to actually do it. So, and it's just judging every client that comes through the door on their own merits. Yeah,
definitely. Because sort of thumb rule will be don't do it with anybody kind of sort of on the older sort of age spectrum. But then perhaps if they were in particularly good shape, then maybe you could do a sort of, maybe wouldn't do a sort of firmest application of it, but perhaps you could with some, if it wasn't, if they weren't too sort of I suppose fragile. If they were particularly unfragile, if they were quite robust, then perhaps you could use a sort of, I haven't, and I'm not sure if I'd necessarily advocate it in a class or something, but I wouldn't be surprised if it would be something that you could maybe.
Yeah, I mean, I quite, on a personal level, for muscle energy techniques, I quite like using them on different populations because, as we said earlier, it incorporates that isometric or that eccentric load. And I find, I just like, from my personal preference, I like loading tissues. I find it just helps quite a lot, and you can have a bit more control of how you load, how much load you put through them, and the range of which you load them. And I think that's why I use them more than kind of the stretching element. I use the stretching element to kind of find new ranges so we can kind of strengthen in and end range. That's how I personally use it. But it's just justifying your own techniques, isn't it?
I think so. Yeah. I think it's it's something that I sort of, I don't know, cut my teeth on to a degree, I suppose. Like I say, I would use it slightly less now. I think when I came out of college, I'd probably use it on pretty much everybody. like when I first trained, I wouldn't use it on everybody now because it's not sort of suitable for every different type of treatment you might want to do, and just increasing range without putting any sort of strength in there is, sometimes it's okay because they're sort of maybe returning more to where they were and you're just fast tracking. But I've heard of cases of people increasing range without any sort of strength work to go with it, and having consequences for like whole clubs because sports clubs because you got players with increased range that they don't have any increased strength in. So I wouldn't, you wouldn't use it for every situation for definite, but I think there are lots of different reasons that you might use it there.
It's been an interesting chat because, like I say, I mean, it's something I use not as much as I used to, but I do use it. So it's nice to get a different insight of, somebody else who uses it and how they kind of perceive it, and I'm sure there's a lot of members out there who probably haven't come across it or should we say don't use it, haven't taken any courses, so they might be kind of starting out in their career and want to know a bit more. So if people want to know a little bit more about it, are they okay to contact you about it?
Yeah, of course. Yeah,
so if anybody wants to contact you, we've got some ones on screen right now. So that's your website, Welsh Town there, so I'm going to let you say the website.
Oh, right. Sorry, the website. massagepontadaur.co.uk.
I would have murdered that. So
Pontadaur or something, isn't it, in English pronunciation?
my brother now lives in North Wales. I should probably start to learn some of the lingo and some of the accents. So that's your website. They can email you as well, and you have a Facebook page, which is Swansea Valley Remedial Massage Clinic. So they can contact you through there, I'm guessing, as well.
Yeah.
Okay. Anywhere else that can contact you?
Yeah, just find me on Facebook and send me a message or whatever, add me or whatever. Just
Good. Well, it's been an interesting chat. So if you want to find out a little bit more about what we do at the Sports Therapy Association, any more CPD, have a general chit chat on one of our pages, you can find us on Facebook, on Instagram, Twitter. Most of our videos and educational content goes up onto our YouTube page. Source of pretty much all knowledge is our webpage, where you can find out how to join if you're not a member, find all the other information about the STA on there. Don't also forget to jump onto our Tuesday podcast with Matt Phillips every Tuesday at 8 p.m. on our STA open page. We have some great guests on there. If you need to contact me, I am based in the Northeast. I am regional rep for the Northeast and regional rep coordinator. You can contact me at scotlandthesta.co.uk. Dan, I would like to say thank you very much. It's been a pleasure.
Thank you, likewise.
Thank you for joining me.
Thanks very much.